Hello and thank you for joining in on today's training. Heart & Solutions is a proud provider of CE eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below to find and take your quiz.
All right, well, I'm going to go ahead and start. My name is Tami Adams. I am a temporary licensed mental health counselor here in Cedar Rapids. I work with a caseload that's about 50-50 children and adults, but moving more into the children realm. My own personal history is that I am a mother of 2 young boys. I'm a therapist at Heart & Solutions, and I like to work with kids of all ages, but I, for some reason, seem to really like little kids and also really like teenagers for completely different reasons. So just they're their own little adventures.
Good morning. My name is Dr. Colleen Grote. I am the Vice President in charge of therapy here at Heart & Solutions. I am also a licensed mental health counselor and a registered play therapy supervisor. My doctorate is in clinical supervision and education. I really enjoy that supervision piece of things, and so hence the RPT-S and getting to help providers explore play therapy and what that means. Tami will do quite a bit of talking today. I will interject with some interventions and things along the way. We want this to be interactive and beneficial for all of you as well. So if you have questions or things don't make sense, please don't hesitate to let us know. You can just start talking, or if you want to use the raise your hand feature, we'll see that as well. But we're really excited that you guys are all here today.
Okay, so very first thing we're going to talk about is that this is a safe space. We're talking about sexual abuse and sexual behaviors. This can be very triggering for some people. There's a lot of feelings that get caught up in sexuality, and children particularly exhibiting sexual behaviors or having been victims of sexual abuse. I want you guys to know that it's okay to have all of the feelings that you might feel. I want everyone in this space to feel safe and comfortable. If you are having really intense emotions and need to take a break, please feel free to turn off your camera for a minute, take a break outside the room. If it's becoming overwhelming, let us know through the chat. You can personal chat us, and we'll be able to talk with you briefly and kind of help you. I don't want you to be alone if you have a big experience of feelings. The statistics are that there's a good chance that somebody in this room may have experienced a version of sexual abuse. And so we want to be sensitive when we're talking about sexual abuse victims and sexual abuse actions. Just be sensitive to your neighbors here on Zoom. Respect the feelings of others. And then the last part is make sure that we're maintaining confidentiality here. Things that are shared in this space, we want to keep in this space, because I want you guys to be able to be vulnerable if you want. Finally, there are going to be times when you may want to ask about particular situations that you've encountered. I just ask that you leave names and identifying information off, because we want to protect the rights of anybody you've interacted with too. The objectives of this are going to be able to define sexual abuse, to be able to distinguish between expected, problematic, and abusive behaviors of children, to be prepared to respond to disclosures of sexual abuse in the playroom, to be ready to intervene with children to prevent reinforcement of repeated harmful behaviors, to be able to therapeutically support parents of children who have experienced sexual abuse, and to be able to identify 10 interventions to use with children who have experienced sexual abuse. This particular training does cover both sides of the abuse dyad. It covers the side of the victim, and we were going to talk briefly about problematic sexual behaviors or children who may experience problematic sexual behaviors. I'm going to really try and avoid words like offender unless it is a court case that has been come to fruition. And sexual abuser is also a word I'm going to try and avoid when using children, because in this particular case, I want to make sure we remember that these are children with sexual behaviors and we want to treat them as such. So we will only say abuser when we're talking about the victims, you'll notice, and then I'll refer, if we're talking about helping children with problematic sexual behaviors, I'll refer to them as such. Okay, So let's talk about understanding sexual behaviors in children. So there's an expected developmental sexuality from birth to middle childhood. Infancy to toddlerhood involves genital discovery, motor skills, touching sensations, arousal, pleasure, self-soothing, and reinforcement. It is incredibly normal for children at this age to touch themselves, to enjoy touching themselves. They might do it to help self-soothe themselves. They might do it in just general exploration. Young children also experience curiosity, and so they may want to show you parts of their body. It's trusted adults. They are trying to experience and figure out what is going on with themselves. We want to be careful that, like, when we are having children who have sexual behaviors, we want to see if we're looking at something that's expected for their age, so touching themselves, completely normal, or if it's something that seems not age appropriate, because that's going to indicate that there's something else going on.
Oh, I'm going to interject, Tammy. I just want to highlight the language that Tammy is using as well, that expected behavior. So when I'm working with parents or caregivers and exploring behaviors that they may have brought to our attention, expected versus unexpected, right? Or like Tammy said, kind of not appropriate for their age versus good or bad, right? Or normal or abnormal. I really try to avoid being like, oh, it's normal that they would do that. Like normal, I don't really know what that means, but I know that it would be expected, right? For a young child to be touching their genitals in a way that self-soothes. What would be unexpected would be a young child touching their genitals to the point of causing harm or pain, right? So looking at kind of those expected versus unexpected and utilizing that language with parents and families as well to take off that normal versus abnormal verbiage.
Yeah, expected is what we are going to use. It generally describes things that we would feel comfortable seeing. We're not going to be like, oh no, this is reportable. Oh no, this is something that causes concern. And this training, I really want to reinforce the idea that children, although they are children, will have normal, expected sexual development, and that not all sexual interactions you may see in a playroom or sexual conversations that may arise in a playroom are going to be due to sexual abuse or due to influence outside of what would happen if they were developing on their own in a perfectly expected way. Moving on to preschool through middle childhood, we'll start seeing parallel play, interpersonal interactions, playmates, friends, privacy and modesty ideas, and gender identity forming. Parallel play means that they are playing with, looking at, watching, imitating things that they are trying to understand. They may imitate their friends or other peers. Interpersonal interactions. I don't know if you've met any kindergartners that have a boyfriend or a girlfriend, but I have. You know, they're still in that learning experience. They may practice interpersonal interactions they see or do imitative play. They'll develop stronger friendships, a better understanding of how they interact with others. Children at this age start to have an understanding of privacy and modesty, but be aware that that is culturally dependent. Different cultures have different expectations of privacy and modesty. And then individual household cultures, because culture can be individual to a specific family, may have different expectations of privacy and modesty. There are definitely families that you will meet out in the real world who believe that, like, we never look at anything, everybody stays in their own room to get dressed. And then there are families that are much more along the lines of, it's okay, you know, we appreciate that you can be undressed or you can come into the bathroom while I'm taking a shower and use the restroom. Those are just cultural aspects. Unless we're seeing some other unexpected behaviors, we're not going to be super concerned about those. But it's important to know that you're going to probably run into different cultures. And then gender identity forming. A lot of times at this age, gender identity is still fluid. There's both the societal pressures of gender that are acting on kids and then their own internal development, and that can be competing. You'll often see cross-gender play, cross-gender imitation. Kids at this age really enjoy dress up, and they may choose to dress up in opposing genders clothes or mixed genders clothes. This always makes me think of my 6-year-old who at the age of 3 just adored wearing high heels. That was just a way for him to explore, like, what are these shoes? What does this mean to me? Why does only one type of person wear shoes and one type not? Looking at children with harmful sexual behaviors. So we know that sexuality develops over time from birth. Children learn how to behave sexually and may learn to be sexually abusive as well. So sexuality comes from many facets of our life. It comes from the beliefs that we are raised with and the culture that we exist in. It comes from the society or the media that we consume or that our parents have consumed. And then it all goes into this bucket that becomes our sexual behaviors and then dictates our relationship skills. Learning sexually abusive behaviors can happen in a variety of households, in a variety of situations. We'll talk a little bit about some of the contributing aspects to getting abnormal sexual behaviors or problematic sexual behaviors. And it's important to remember that of all the children who are sexually abused, more than half of the boys are abused by an older child, and 15 to 30% of girls are abused by an older child. So sexual abuse happens between minors. And we're going to talk a little bit about some of that situation. Boys are at greater risk of sexual abuse outside of the home, and girls are at greater risk of sexual abuse inside of the home. There are times when you will run into familial sexual abuse that happens. It is more likely to happen to girls, but it can happen to boys. When thinking about these statistics, I want you to just remember that they're a guideline. They can help, like, where can I start looking for, or where should I be focusing some concerns? But know that they can be the opposite. Boys can experience sexual abuse within a home, and girls can definitely experience sexual abuse outside of a home. So again, I got ahead of myself, talking about perpetration prevention. Sexuality is a mixture of identity, attitudes, and beliefs. There is a hierarchy that helps us build what it is, like a triangle. At the top of it is usually the beliefs that are given to us by parents. It's our cultural belief system, our ideas about sexuality. This is where religion will come into play with sexuality, as many families incorporate that into the idea. It also comes from that cultural component of what do we know about interacting? What do we know about, what does our family feel about interactions between the sexes or interactions with peers of the same age? Then there's attitudes. Then there's identity. Identity is, again, that core component of trying to figure out who we are. There's identity. And then as we go down, we'll notice that direct teaching and information that's provided about sexuality plays the smallest section here. So it's at the bottom of that list because it has the least impact. Those top sections, the beliefs, the attitudes, the identity, are going to contribute to our behaviors, and our behaviors are going to make our relationship skills. So if we have a good solid foundation, we may have behaviors that are positive towards our partners, respectful towards our partners, respectful towards our peers, and then we'll be able to make solid foundational relationship skills and have good peer interactions, and later in life have good partner interactions. Whereas if we have a basis of behaviors that are disrespecting personal space, no autonomy of your own body, and not having a respect for, like, the ability to say no, we'll obviously translate that down into interpersonal skills that are not going to be very positive and may result in problematic behaviors. So let's talk for a minute about messages that exist in our communities that perpetrate abusive behaviors in young children. So I would like to hear about just what you have heard out in the world that you think is contributing to children's ideas about sexuality or helping to encourage abusive behaviors in children. And this can come from anywhere: families, media, society in general, education.
I think it makes me think, a little background. I'm the mother of 2 young girls. So different experiences than Tami with her boys, right? And I was talking to Tami the other day and saying, I'm thankful that I haven't heard it much. My oldest, it just turned 7 and my youngest it just turned 3. But it makes me think of the playground days, right? Where somebody's like, oh, that boy likes you if he's, yeah, exactly. Kendra just shared that, right? Boys are mean to girls because they like them, right? Like, it's okay if they're aggressive towards you. It's because you're cute. It's because they like you. No, right? And I was sharing, like, I have not heard that come out of my 7-year-old's mouth as a reason for behavior, at school or anything like that yet. But I'm sure it's been said or will be at some point. Mm-hmm.
I think with the development of as I'm thinking in my generation growing up, and kids would talk, playground talk. It now has become, the internet is so saturated with so many of these attitudes and behaviors that, society says, well, that's okay, or that, and so young children can pick up on these things, right? They consume them in the home or with friends or, so there's a lot of different avenues, I think, that are in place than there were when I was growing up. So it's a lot different. And even when my kids were growing up, I've got all adult children. So I'm in that, next phase where it's like, my kids aren't littles anymore. So they don't have that, I have 2 younger ones that got more of the media aspect of it. But it's just a different kind of environment for kids today. And, we just have to keep remembering that these kids they're exposed to a lot more and they're sponges. They absorb it all.
And Maria, that media point is so important, right? Like I was talking to somebody the other day and it was like, okay, before, if somebody was seeking out sexual images, right? Or that expected curiosity piece, that was difficult to get, right? Like kids maybe found a magazine in their parents' bedroom, right? Or like now they literally can type in any search they want and they are flooded with things, videos, images, information, and they may not even be seeking that, right? And now it is given to them. I just this morning was watching a TikTok video and somebody was looking for a summer corn recipe on TikTok, and corn is not what showed up on all of her TikTok videos, right? And so things that we are now bombarded with, even when we're not intentionally seeking those, and as children, right, not necessarily knowing how to process that or not telling the adults in our lives what we saw, and then kids, one of the things that we know from play therapy in general is kids try to make sense of the information they have, right? And so if they don't have all the information, they make it up, they fill in the blanks, which tends not to be a great option for them. But now we have all of this sexual behavior and images and messages are at their fingertips, even unintentionally, that creates all sorts of messages about those behaviors.
On the idea of TikTok, I want to bring up the concept that like some of these aren't meant to be messaging for kids. They're not meant to try and influence relationships, but they certainly set an idea out for children. And I'm thinking of my middle schoolers and kind of that 5th, 6th, there was a TikTok that was very popular about the musical Heathers. And there was a lot of obsession about this one song that's sung where a boy approaches a girl's house with a gun and is just like, oh, I love you, I absolutely need you, I'll die without you. And there was a lot of conversation about how romantic that was, without much conversation about the abusive nature of that and the other things that come. And so even though that's a relatively safe space for children to be existing in, exploring, without some guidance, it can certainly start to shape relationship problems that can put themselves at danger or other at danger.
I recently had a conversation with a family member about how she doesn't want her daughter to keep secrets. She said surprises are fine, but secrets are not. And I actually thought that was pretty interesting and helpful because when I was growing up, if you had a secret, you kept it. And I know that sometimes that can lead people as they get older, if they encounter something unsafe and, like if an abuser tells them to keep it a secret, then they've grown up knowing that, and they're like, oh, I have to keep this secret. So I actually thought that was really smart. She told her daughter, if somebody tells you to lie to mom or dad, tell me immediately. And I don't know, I really liked that. I thought that was smart.
I love that. I think that's a great way of really trying to encourage safety within your family, and like, hey, you can come to me. I am a trusted person. And I know that dealing with kids, there's always that battle that comes between, is it tattletaling or is it an emergency? And I think that that's a really positive way to try and reinforce the idea of like, yeah, no, that's an emergency. You need to come tell me.
Kendra, it's great, right? We use that languaging at my house as well, right? And we talk about surprises are fun because we eventually get to share that with someone, right? Surprises are fun because we get to tell everybody as a surprise. Secrets are not fun because, we're not telling people, and that's never the end goal, right? Same with things like doctor's appointments and things when we do need to explore private parts and things like that, and talking about those are okay because they're telling mom or dad, right? And they're not doing that in a way that is not informing that or whoever. It makes me think of the same languaging, kind of the old mantra of good touch, bad touch, right? And even just 10 years ago, we were talking about good touch, bad touch. And one of the things that has come to light, especially when we're thinking about messages, is that sometimes inappropriate touch feels good, right? So when we're talking to kids about, tell us if somebody touches you and it's a bad touch, right? Or somebody hurts you. Not all sexual abuse hurts, right? Like Tami was sharing on those first slides, stimulation, because it can feel good. And unfortunately, abusers and perpetrators who are, know what they're doing, that can feel good to kids. And so rewiring that language of good touch, bad touch can be really important in normalizing that sometimes the abuse feels good, right? But it doesn't mean that it's okay. And so just being mindful of that message as well, that we unintentionally can reinforce when we're trying to do sex abuse education.
And isn't that incredible, Colleen, that it wasn't that long ago? Because like when my kids were little, that's exactly what they were taught. And we talked about it at our home in a different way. So we were kind of starting to kind of come out of that little, the whole good touch, bad touch thing. But just that, kind of that's the whole secret and surprise kind of thing. We tried to do that too, to just make sure that our kids knew that, and if they didn't feel like something, you need to tell mom and dad are trusted people. So, you can communicate with us. And that's what we tried to do with all of our kids. So I have 4. So that's it's hard. I mean, and every single child is different in their ways of interpreting things. And, some kids are more private than other kids. I have one of my daughters is super open about everything, and she's always been that way. And then I have one daughter that never discloses much of anything at all. So, and that's how she, they were all brought up in the same household, but they're all going to be different in the way they process through information.
I think Maria brings up a really good perspective on the fact that sometimes as providers or as counselors, our clients can also be the parents, and the parents are coming in with their own ideas. I have had parents come in and say, can you make sure that she doesn't talk about touching herself because it's inappropriate for her to talk about that. And that messaging was really shutting down this girl's ability to explore her own sexuality after sexual abuse. It was this idea of that's bad touch, it needs to be shut away. But the box had already been opened for this girl, and she had to explore and understand what had happened to her. And really, it was the parents' ideas that were starting to kind of interfere with her recovery in that sense. Okay, I'm going to go ahead and move forward. If you guys have anything else to add, please just let me know. We are going to talk about risk factors for harmful sexual behaviors in children. First risk factor is exposure to toxic masculinity. And toxic masculinity is a hot topic right now. Oh my goodness. And I want to make sure that when we are talking about toxic masculinity, that we understand that this is not a gender-specific attack. We are not saying men are bad, or men have been bad, or men can be bad, because we do know that all genders can have problematic sexual behaviors. When we talk about toxic masculinity, we're talking about this long-standing cultural idea of men over women and how it's impacting children, particularly men over women in a dominating way, in a way that it is restrictive to the other gender, in a way that can be objectifying, making that person seem as if they're an object or something that is solely for the purpose of the man. And then it also contributes to domestic violence and emotional and verbal abuse that we see in relationships. Toxic masculinity can play an important role in what we are viewing, even though we live in a fairly woke culture. You know, we are still learning about the effects of encouraging that masculinity. Going back to that TikTok video, that was a moment of toxic masculinity. The idea that this guy would come in and demand that she take him back, and how romantic that seemed, you know, and all of the girls, they saw this as a very romantic gesture. And that's because there is that long-standing cultural idea of, this is how things are, this is how people show their love. I always think back to middle schoolers. I have a number of middle schoolers who do testing of their partners, where they'll have a friend test their partners by texting them and saying, oh, I like you, to see how loyal that partner is. And again, this is a concept of toxic masculinity that has gone forward, that cheating is an expected aspect, and that finding those golden people who don't cheat is unique and special, and so you have to try and test for it.
You know, we're talking about children today, but we're also talking about the messages that they receive, right? And some of our adolescents too, again, just exposure. And all I can think about is like the horrendous, I think it's on Netflix, but the horrendous show of like, I don't even know what it's called, The Ultimatum something, but essentially it's these couples that have been together for years, and one of them wants to get engaged and the other one isn't quite ready. So they all go on a show together and they switch partners for a length of time, and they can choose to be with the new partner, or the other one has to propose, or they break up, you know. And it's just, again, like Tami said, I think we tend to think sometimes of like, oh, these big men like infiltrating this toxic masculinity. And yet these messages have just become like a part of our culture in so many ways. Like and so just being mindful, again, like we talked about with the other messages, it's coming from so many sources in so many ways that it just becomes embedded, even when we're not looking for it.
Ooh, I grew up during the wonderful age of wife swap. Wife swap, which was an entire show based on the idea that you would just swap wives around, and it would be like, look at how they adjust to this family, or look at how they can't handle this. And it would always be like really dramatic situations where it's like a vegan and a hunting family and wife swap. But that basic idea, like even the name of the show is wife swap. It's not family swap. It's the idea that people can be interchangeable, and that this is objectifying women as if they could just be moved back and forth. And I don't think that was the intent of the show, but I think that still played a role in the development of people of my age, is seeing that and trying to process that information. Oh, go ahead.
I was going to say, you know, growing up in the age of wife swap, I grew up in the age of hee-haw. And that was, you know, for, you know, young child seeing that, you know, where women are objectified, or even things like, you know, what they call the Lawrence Welk show back then and all that stuff. I mean, all of that really gives the message of just how the objectification but even, you know, just kind of continues, you know, so.
I'm glad that you brought that up, because this brings me to the idea that it, like, when we talk about it exerting pressure on both genders, it also exerts pressure on men. And I think all the way back, I'm a big fan of old shows, back to the Lone Ranger, or not the Lone Ranger, the Rifleman, and to Andy Williams. It is the idea that they had to have wives, that they couldn't be single fathers who took care of their children, that it was so sad that they didn't have women to take care of them, And even back then, like, that was a pressure that men were feeling, like, you couldn't do this on your own. You have to have that other part, because that's how this works. And I again, those shows are really, really positive, but at the same time, they were showing us this cultural idea that continues on and that can affect our children and can affect how we see things. So child maltreatment and deficient environment. This is going to impact harmful sexual behaviors because we're going to have the absence of a trusted adult confidant. We may not have any adult confidence that can be trusted, even if we're in a stable home. We might have changing adult confidence. So people who, due to the influence of drugs or mental illness or other stressors, can be trustworthy one moment and not trustworthy the next. This can cause like a lot of confusion for kids because they don't fully understand what's happening. They experience neglect or non-empathetic home environment. So children that don't have the support they need from their parents, whether that be just straight no support at all, they're kind of on their own, or if it's a situation where the parents are just very unempathetic to the child's development. There is still a very prevailing thought that comes from the Victorian ages, if you were curious, this is a Victorian idea, of children as just young adults. And that comes across as a very unempathetic view of children because we know now that they aren't young adults and that their brains work on a very fundamentally different level than adults would. But if you have parents that are just like, you should be able to take care of yourself, and you have a 6-year-old who's still trying to learn the world, you're going to end up with the possibility of some harmful sexual behavior. Another thing that we want to be worried about is developmental concerns. So this can include ASD and intellectual disabilities. So ASD is autism spectrum disorder and intellectual disabilities. This also includes attention deficits, issues with impulsivities or affective disorders. Impulsivity is a big contributing factor in this. Sometimes we see children who have harmful sexual behaviors that are not out to perpetrate or not out to hurt others, to have that impact, but are unable to control that base impulse. And so if it comes into their mind, they're going to do it right away. As counselors, we might see that we have to start stretching out impulsivity, starting to get them to stop their actions. And we'll probably do it in a way that isn't focused on sexuality, but can impact their ability to control their sexual behaviors. And then we'll see poor relationship skills. Again, relationship skills come from so many different factors. And when you have children in different homes, with different environments and different peers, they may get a set of relationship skills that are going to be inclusive of some harmful sexual behaviors. And that harm can be towards them or it can be towards others. So you might have children that have abusive behaviors in the sense that they are looking for people that are more apt to abuse them. Like their relationship skills are set up so that they want people who are going to be of that more abusive nature. So let's talk about caregiver discomfort. Everybody's favorite topic. This is kind of going to be the base of a lot of what you see. Caregiver discomfort plays a huge part into the sexuality of children. And I work with children, I have children, and I will tell you that like the discomfort never fully goes away. You just got to kind of scoop up and do it, and you're going to be okay at the end of it. But there are two different ways that we can really express that discomfort, or that parents or caregivers can express that discomfort to children. It can be indirect. We can start using words that are like, or we'll try and use innuendo such as, oh, they were just playing doctor when talking about exploring sexuality. And we're just trying to make ourselves a little bit more comfortable and, you know, rather than saying, yep, they were touching each other's genitals. But it can give this confusing message that touching each other's genitals is what doctors do. And, you know, we've seen in the media that can be a very dangerous message to have because not all doctors can be trusted.
Tami, I'm going to interject too, just from a parental kind of psychoeducation standpoint too. When I have a family that I'm working with, right, and we're kind of going, like, what messages are you giving? How are you doing these? There's two really important things that come up for me. Be ready to hear that information, right? If we think of a little kid who potentially is on the verge of disclosing, or what we call an accidental disclosure, which we'll talk a little bit more about later. The parent walks in and they're playing doctor, right? One of the most important things that parents can do, and I'm not saying it's easy, right? Like that stomach is turning, it's difficult, but the more neutral a parent stays and the more curious a parent stays of like, oh, tell me about the game that you're playing. Have you played this game a lot? Who thought? The more neutral we can stay, the more willing children are to tell us the information that we may need to figure out what's going on. The second, and it's an expected response, but the second we go, what are you doing? Our kids go, oh, that's bad. And I don't want to tell mom about it anymore, right? That's a bad thing. I'm going to shut down. So if we can hold that lump in our throat, right, and attempt to remain curious, we can often get more information about what's happening so that we can then address it as needed. The other really important thing is that we're using appropriate terms, right? You guys might have saw me step away earlier. I went and grabbed some of my favorite books we'll talk about when we get to interventions, but I was looking for one of my favorites called The Penis Book, and I can't find it. But it is a book that literally I use with almost all of the families that come to me with children who have experienced some sort of sexual abuse, because it forces the families to say penis, 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 vagina, 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 and all of the other parts. And it's that session, right? I have moms and dads and grandmas and grandpas who are like, I can't say these words, right? Because these are the words we're going to talk about as we do this work with your child. And it's important that we not only do this work here and use these words in my office, it's important that these kids know these words in the real world, because unfortunately what we've seen are disclosures that aren't understood because the kids have cute little names about their private parts, right? And, you guys may have heard this one, it's a really common one, but I've worked with some kids before, when we call it, our vagina is now a cookie, right? Well, when my uncle touches my cookie, big deal, right? When Johnny licks my cookie, then the teacher's just like, stop, like don't share germs, right? No. What Johnny's doing is licking my vagina, right? Which is a whole different concern. And so when children don't have the proper names to share with others what's happening to them, because this caregiver messaging, right, it's uncomfortable. I don't want to say penis. It's really hard for our kids to tell us then what's happening to their body parts. And so this indirect messaging, well, oftentimes isn't meant to be dangerous or harmful to children, can have those implications later on if something does happen.
And usually you'll run into parents who are very uncomfortable with that at the outset, because I think that certainly older generations, it was like, let's not talk so directly about this. I think of my now 4-year-old who told my mother about his testicles once, and she's like, he just called them his testicles. And I'm like, well, that's the word we've always used with him, because that's the word that I want him to use. And of course he comes up with names and we redirect him. But for her, it was this shock, like, oh my goodness, why would he say this? Why wouldn't he use something else? And so kind of adjusting her to that was an interesting process. Other indirect messaging issues we can run into is if people are not specific about the behavior. So cut that out, don't let me catch you doing that, but without ever explaining what that is. And again, that's usually a part of the discomfort on the caregiver's part. We want specific, direct words for what the behavior is and what isn't allowed. And that helps set that boundary, that good boundary for that kid. Like, it is not okay for Johnny to touch your vagina versus it's not okay for him to do that. You need to be specific, and parents need to be specific, and that can be a hurdle for them because it might make them very uncomfortable, or it might bring up some very troubling thoughts and feelings if they have to say that, especially if they have a child who has experienced sexual abuse.
Like Colleen was saying, like if you respond with a response that's almost like with anger and like, because it shocks you and you're like, oh no, don't ever do that. Then you're instilling that piece of fear for the child that they're going to be like, oh, like Colleen said, like, that's bad. I don't want to talk to mom and dad about that anymore. I'm going to keep that inside. And because that fear piece is there, and now they're scared. So they've quickly, kind of shrunk back, and their response is to stop talking.
Yeah. How we respond to kids is incredibly important. And as you'll notice as a provider, your response is, if you have a kid that's very well attuned to you, so a kid that has been with you for a while and focuses really well on you, is usually when they feel the most comfortable to disclose, if they're going to disclose. But they also are very good at looking at your face, and they can read micro expressions. And so there's a lot of like deep breathing that you might have to do just to avoid some of those micro expressions, because they are going to be so attuned that they're watching, like, is there anything? Is this person in any way grossed out, upset, disappointed, angry at me? And then it will cause them to shut down. And they'll drop it at these most unexpected moments where you just have to be like, yeah, go on. And it can really catch you, but practicing that facial awareness, because these kids trust you. They have attunement to you on such a high level that it's not even the big dramatic actions that can make it. They might be looking for those small signs of disappointment. The last one I wanted to talk about, indirect, is inappropriate. And this is always hard for me because inappropriate and appropriate are like my favorite words. And I really have to stop using them. But kids don't have a very good concept of appropriate or inappropriate. So we need to be more direct in our words and say that can hurt, or that is not safe. If they have an idea of what safety is. We can't just say appropriate or inappropriate. You can say that makes me uncomfortable, or that makes others uncomfortable. That makes them feel yucky inside. You just want to make sure that you're giving them these specific ideas of what's happening, and not just this word of like, that's not appropriate. You can't show yourself to others because that's not appropriate. You need to be more specific and say, that makes others uncomfortable, or that makes them feel yucky. Depending on the age range. Uncomfortable is not so great with 3-year-olds, but fantastic with like 10-year-olds. So then direct messaging is the messaging we want. And we've kind of already gone through as we went down the list. We want specific. We wanted to explain what the effects are for that child. We want to explain if the behavior is abusive. We'll explain that it can hurt others or it hurts other people. And we want to really focus in to make sure the child understands that this is the rules. These are the things that we don't do, and this is why we don't do them, rather than just telling them these vague kind of don't do that. So let's talk a minute about indirect messages about sexual behaviors that we have observed from children, parents, or caregivers in the playroom. And I know we've talked a little bit about this, but I want to hear if you guys have any other ones out there.
Tami said, I know we touched on this, but oftentimes I see this even at the beginning when I get a referral, right? And the referral says, hey, we're coming in because I, believe, or I know, or whatever, that my child experienced sexual abuse. And then we get to the intake and they're like, yeah, like sometimes they're sad. Okay. Like we need to talk about that. And, one of the things that I try to do with families, right, is not necessarily like force this child to put their trauma narrative out in the open in session 1, but we want to say, hey, like mom and dad are bringing you here because X, Y, and Z happened, right? Or asking the child, can you tell me, why are you here? And I will let them know it's okay for us to talk about whatever it is, right? Fill in the blank whenever you want to. We don't have to today if you don't want to. But I work really hard with the parents to do permission giving, right? And so before I've even done anything else with this child, I will go around the room and, hey, mom, is it okay if Sally talks about her private parts in here? Yeah, that's okay. Is it okay if Sally tells me what happened when, so-and-so touched her private parts? Oh, yeah, that's okay, right? And Sally, any trouble for talking about her private parts or talking about this or that, right? And I make sure, even though we may not be talking about that day and the child doesn't have that trust and that rapport and that safety with me yet, that we can always then reflect back on when the child is ready to talk about it, those direct messages that I try to force, might be a strong word, but from parents, right? That it is okay to talk about those parts and use those words and say those things. because yeah, a lot of times those intakes can be so indirect and like, we're going to talk around this as if the child's not here. And I don't know, the child experienced this. Like, we can put it out there that I know and that it's okay. And this is a safe place for the child to talk about that abuse.
I think one of the ones that kind of things like rings out to me when I think about indirect messaging is I had clients who were coming to me for sexual abuse, but the parent that was bringing them could not talk about it on any level whatsoever. And it permeated down to the kids. We just didn't talk about the incident with the cousin, what happened with the cousin. And it really developed this like shame narrative that they had gotten just because of the parents' extreme uncomfortableness with the situation and not knowing what to do. But it had developed a shame narrative like that they could not talk about that. And so when they did talk about anything even around it, our voice got really quiet and we started to whisper because it was a secret thing. We didn't want people to hear, even though the parents weren't in the room. And when I see that, I know it's because like that indirect messaging has led to an internal monologue for these kids.
Which unfortunately, Tami, is really sad because then the kids have to process through all of that and they don't know which direction to go with. You know, if they're getting the message from the parents that it's not okay, it's, you know, something that we just want to keep quiet and we don't want to, then they're getting a mixed message saying, well, I want to please my parents, so I want to do the right, you know, and then they're conflicted. And then that's a problem for them going forward. And trying to figure out what they do with all those feelings.
Real quick before I move on, because I for the sake of time, I want to make sure I'm keeping an eye on it. But the opposite can happen too in the playroom. And sometimes it's with the older kids or kids that might have other disorders or mental health issues that are affecting them. But you might end up on the opposite where you have to make sure you're not giving indirect messaging because they want to tell their story to everyone. They want to tell it to their new friends that they met, the guy on the bus, the guy at the bus stop. Like they want to share this information with everyone and it becomes a part of their narrative. And so then your job as the counselor is to help guide them to personal safety while also not developing a shame-based narrative. And so you'll want to make sure you're using direct messaging and being careful and not using indirect messaging. You know, it's sometimes strange to have to say, like, this is definitely your story and I want you to be able to share it. However, I want you to share it with safe people. And then I have to go through and identify what makes a safe person and what makes an unsafe person, rather than just saying, like, I don't think we should talk about that at the bus stop, which would be really indirect messaging for them. Okay, I'm going to move forward, but if anybody has anything else, you can definitely drop it in the chat. Like I said, I want to be mindful over time. So motivations for sexual behaviors in children come from exploration and curiosity, sensation seeking, reinforcement, improvement for feeling better, self-image, imitation and learning, pleasuring ourselves and others. You will have definitely people pleaser children who are interested in making sure that the other person feels good. And then there's also anger and retaliation. So anger and retaliation and improvement and improving our self-image can sometimes, or are the more apt situations that are going to lead us to problematic sexual behaviors. If we're acting out of anger and retaliation using sexuality, we're often going to develop some of those harmful behaviors. If we are acting out of trying to improve our self-image, we might be more prone to attracting harmful sexual behaviors or putting ourselves in situations where harmful sexual behaviors are likely to happen. Oh, I just saw something in the chat.
Please talk more about examples of how to explain discreetness and self-protection with disclosing too much or recognizing. Yeah, great question. I've got some interventions as we move through. Like Tami said, we want to talk about how to identify a safe person, right? And talking about what those boundaries look like and who those people might be that we want to share that information with. And so, Tami, you may have some other things as well, but you know what I help children especially kind of think about is what are the, you know, who are the people in their life that they feel safe with, and what are the characteristics about those people, right? And helping them identify who those people are, And then also talking about the same way that our body parts are really special and really important, right? We don't want to walk around naked and share those parts with everybody. There are some great bibliotherapy sources, some great books that talk about that. I've got some here and I can link them as well. But just I really try to come at it from a direct approach also of how special they are and how important their body parts are, how important their experiences are, and that we don't want to just give those away and share that story with everyone. But it's a process. And like Tami said, we see this more too with children who have some disrupted attachments, right? So when we think about attachment disorders, we tend to either kind of go all in or all out with individuals. So those clients who try really desperately to form an attachment with everybody and everybody's their best friend and they love everybody and they don't know this person's name, right? But they love them and they want to give them kisses and they want to give them hugs, right? Like those are often the clients that we are having to set boundaries across the board with. And so trying to do that from a strength-based perspective, while also talking about safety. Right? We don't want to get in the car with anybody that asks us to either, that happens to be there, those types of things. And it's not an easy road because like Tami said, we want to validate their experience, but also help keep them safe by not putting that experience out into the world. With slightly older children or adolescents, one activity I will have them do that's not in these slides is just kind of do their circles of support. I also do this intervention with kids who are having a hard time with friendships and relationships not related to sexual behaviors. But I'll have them put their people, right, in various circles. So if you picture a bullseye, those closest to them go in the middle. We work our way out. What we talk about is once somebody comes in to a circle, right, once they're in said circle, sometimes my teenagers will say, well, I'm mad at them, so I want them to go out here. We can do that, right? But we can't get rid of what they've learned and obtained in this inner circle. We can't erase what we've shared with them. We can't change the information that they have. And so talking to them about what needs to happen to move somebody into a circle and what characteristics and qualities and experiences they want to feel ready to move somebody closer to them. They don't have to so often move somebody back out. And so that same intervention can be adapted when we're talking about sexual abuse, right? And like once we tell somebody, if we decide we're mad at them or we don't like them, we undo what they know. So just helping them gain that autonomy over the decision to share or not share.
For younger kids, you can definitely develop a culture in your playroom that really values the information that they share with you. I mean, I will sit I'm at my computer. I'll sit next to kids on my computer. And if they share something like, oh, I remember when that happened in my family or something like that, I'll be like, oh, I'm so happy you told me that. Thank you so much for sharing that with me. Because I want them to understand that their information is important and special. And I love it when they share it with me. And it was a very big moment, but it also is going to help set that role down the road of, you have special information and your special information should only be shared with certain people, like certain people that are safe and that you want to share them with and that are going to make sure they keep it safe and happy. And I do that just by starting with even small bits of information. Like if they share the name of their dog at the very beginning, it might be the name of the animals and they'll be like, oh, I'm so happy I know the names of your animals now. I love animals. And that's that client-centered kind of outward in approach. We're not talking about sexuality directly now, but we're building the foundation for us to start talking about it as we go, so that when we do get to those sexual talks, then I can say like, oh, that is like super special information. And I want to make sure whoever has this super special information is going to use it very nicely to you and be able to keep it very safe.
Absolutely, right? So a lot of times I'll have families ask, well, we think something happened, right? We think that there was sexual abuse. How do we know? We don't, right? Until a disclosure is made, I can't ever say for certain, unless there's a disclosure or a medical exam that says so, we don't. But there are some things that we want to pay attention to with children that may lead us to have, more direct conversations about potential sexual abuse. So, and I always tell parents too, again, like these behaviors do not, even if all of them are happening, it doesn't say like, yes, sexual abuse has happened. It can increase in nightmares, difficulty sleeping alone, just a sudden fear of the dark. One thing I'm always really paying attention to is things like bedwetting, and not the big part with bedwetting is it a child who was previously potty trained, right? Like no incidents, doing really well. Are we seeing some of that regressive behavior with bedwetting or enuresis throughout the day? Yeah, so that's a big question. I ask about that a lot at intakes, right? Is this child potty trained? How's that going? Where are we at with that? Are we having any accidents? Just increased sadness, withdrawal, right? Irritability, anger, all things that we may expect to see when somebody's experienced any type of abuse. And the symptoms too, right? Headaches, stomach aches, things that the body feels that maybe we weren't experiencing before, and just fatigue, right? It's exhausting when we're experiencing abuse. Our cortisol levels skyrocket. That's a whole nother training, and we don't have time to do, right? But thinking about how much effort it takes for our body to be scared and in that fight or flight mode. And so just general feelings of tiredness, right? So when we're talking with families, just exploring what symptoms that child is sharing and experiencing, and looking at possible sources, and just paying attention to those warning signs. Other things that we want to be mindful of, are things, again, going into that expected versus unexpected camp. Children may display sexual knowledge, language, or behaviors. This says inappropriate. I stole this slide from another one of our providers' trainings, but that are inappropriate for their age. So things like hyperarousal, right? One thing that I'm always mindful of is, does the child have information that child shouldn't have, right? So when the child says something, we had sex, right? I always play really dumb. We had sex? Tell me, what's sex, right? And sometimes kids will be like, well, I don't know, right? And I always kind of play like, I'm getting old, right? In so many things. What does sex mean nowadays, right? Well, sex means that we held hands on the bus. Oh, does sex mean anything else? No, right? But we had sex, right? Okay. Or sex means that they put their penis in my vagina, right? Or whatever. Like, I want to gather that information. So again, being really curious, being really open, like Tami talked about earlier, not shutting down or giving any facial expressions away. Because if I have a 3-year-old in my office who's telling me about, stuff that they shouldn't know, right? There's not a way, a 3-year-old isn't getting on. I mean, my 3-year-old can access YouTube, right? But like typically isn't Google searching for words or phrases, right? And being able to explain those. So if a 3-year-old is telling me things that they just shouldn't know, that's always a cause for concern, right? The only way that they would get this information is from this experience happening to them or in front of them or around them. Hyperarousal, right? Again, sexual abuse can feel good. And so sometimes we will see children self-stimulating to the point of causing pain or damage to themselves because they're seeking that stimulation to a point of hyperarousal. And perpetration on others, right? Again, especially, as we're talking about children, those sexual acts, those sexual behaviors are things that they shouldn't know at that age. And now we may see them, perpetrating is a strong word, right? But trying to reenact or recreate or get others to do those behaviors to them or with them in an unexpected manner. So with non-same age peers or to a level that we wouldn't expect. So just being aware of how much information should this age know versus how much are they telling me and what are they doing with that information. Also, some things that we want to be just aware of as adults working with children is what are our children experiencing? So again, like love-hate relationship with the internet, right? But extensive grooming techniques. I had a client one time who was being sought, and groomed for what I believe was probably going to be a trafficking situation. But this person is sending a cell phone to the client's house, and because the client said, my mom won't get me a cell phone, and new clothes and expensive items. So we see that as well. Often, especially when the abuse is happening from a much older student, much older child or an adult, we're telling these children that they're telling these children that the abuse is normal. Everybody's doing it, right? And if you really want this cell phone, you're going to do this, right? Or mom wouldn't be mad if you did this, right? And so just being mindful of what we're hearing our children say and do and what's happening. And again, just like the sexual act itself can sometimes feel good because our body is normal. It feels good to be given attention, right? And so, kids can often stay engaged in, with the abuser, with the perpetrator, because it feels nice to be wanted, right? And so being mindful of what those relationships look like. It's a little bit off subject, but I'm going to talk about lots of interventions, and we could keep you guys all day. So I really want to be mindful of time. But one thing, when we talk about it feeling good, right? I know I've mentioned that a lot today. Working with some older children, I want to take credit for this and I can't. If anybody's familiar with Eliana Gill, it's an Eliana Gill intervention from years ago. But she had a client who was really struggling with guilt over the sexual abuse felt pleasurable, and this client was like, I know that this is not okay behavior, but I can't get over, I feel really guilty that my body felt good. And so had this client take an onion. It was an older client, obviously, an adolescent client, and took an onion out during session and had this client start chopping an onion while talking about like a sports team practice that client had gone to that week. And the client's eyes started watering and tearing up. And Eliana Gill was like, why are you sad? Right? Like, why are you crying? You're talking about soccer practice or whatever. And the client's like, no, my body's just reacting to this onion, right? And it was such a poignant way to be like, yes, like our feelings about something don't have to be tied to our body. And I work a lot with kids of our body. That means our body's working, right? Our body is so strong and healthy and doing what it's supposed to do. What's not fair is that somebody took advantage of that, right? And so I really just love interventions along those lines. For individuals who are struggling with the incongruence of my body liked this, but my brain didn't, and normalizing those reactions.
I'm going to go into green, yellow, and red. I'm going to go through these a little bit faster than we have been, but I think that you guys have a really good basis. So I'm not too worried that it's going to blow over you and be too fast. So in this training, we are going to refer to green, yellow, red, and dark red. I unfortunately did not come up with the color scheme, but the dark red, these are going to be our categories for sexual behaviors. So green behaviors are going to be developmentally expected behaviors and easily redirected by adults. This is going to look like a kid, like a 4-year-old who might drop his pants in front of, his cousins. I'm drawing from personal experience with this one. He might drop his pants from in front of his cousins. And then it's developmentally expected, there's curiosity, and again, we can easily redirect. Yellow are going to be our slow down and proceed with caution. And adult guidance is going to be more important. So these might be the behaviors that have happened more than once. We're not understanding, or we're not able to process that we can't do this, even if we've been reminded. It might also be behaviors that are more concerning. Red are going to be further from the norm and clearly problematic behaviors. So exposing ourselves in incredibly public places, or masturbating in school. That's another one that we see. They're problematic behaviors. They require adult guidance. And then bright red are our must-stop behaviors. These are usually the ones that we're going to have that moment because it's going to look very dramatic. They're potentially harmful events. Any type of penetration between children is going to fall under the must-stop category. Doesn't necessarily mean that we're going to go all out and be very upset, or that there's going to be a CPS investigation, but it definitely means that we need to be intervening right now, right away, and helping to mitigate the situation. Expected sexual behaviors, so that green zone, are discussions with same-age peers, adults, about genitals or reproduction. Curiosity about your own or same-age peers' genitals. Again, boys at a certain age start going to the bathroom together. You'll notice there'll be discussion about genitals and things looking different, things looking the same. Self-soothing touching of genitalia for self-regulation, pleasure, if it's happening in a location that is safe for that child, in their bed, in the bathtub, that is still considered a green behavior. Attraction in older children, kissing and flirting. I know that sometimes parents get very kind of like, again, that cultural piece can play into this. But we do expect older children to have some level of attraction to each other. That's a hormonal change that's happening in their body, and that they might explore very light kissing, flirting with each other. They might say, oh, that person's cute or hot. Like, that's not abnormal behavior. That's not unexpected behavior. That's very expected behavior. Dirty words or jokes within a peer group. Unfortunately, this sometimes can get out of hand, but again, we are still in the exploration part of our childhood. And if we've heard a joke, then we want to know why it's funny. And so we're going to repeat it again and again and again. Yellow flag behaviors, again, they're not super big and dramatic. They're not too far off from green. You're only going to observe them occasionally. So again, this might be a situation where it's not green. We know, expected behavior might be exposing yourself or exploring your own genitalia on your own. But now we're going to do it on a playground. Or now we're not being able to be redirected as easily. That's going to fall under a yellow category, where there's going to be more adult guidance needed. And this often can relate to imitation. So we might be looking for, hey, where did you see that? Or where did you learn that? Or did somebody else do this? It can come from really innocent sources. Captain Underpants. I both love and hate Captain Underpants in a lot of different ways, but you'll like ask, like, why did you expose your butt? And they'll be like, because it was super funny and Captain Underpants. And you'll be like, oh, okay. Well, again, this is a fairly harmless situation that resulted in this, but now I have to guidance like, that's funny in a cartoon, but not in real life. And we want to protect that part of our body. I'm going to talk about goals of adult intervention at the end of these, because it's going to come pretty much across the board. We're going to talk about them the same way. Potential problematic aspects of yellow flag behaviors are if the behaviors are more intimate or explicit. Again, we want to know where it's coming from. If a child is preoccupied or confused, so if they are constantly stimulating themselves, masturbating to the point where they're hurting themselves, or it's distracting them from other jobs or duties they have in their life. If a behavior interrupts or interferes with the child's everyday life. If these behaviors are interfering with that child's ability to have interpersonal relationships with their peers, that's always a concern, because that is essential to children that are growing up. And then when actions are the result of abusive attitudes that are manifesting as behaviors. So you might start to see abuse kind of get imitation play here, or the idea can come from this concept of like, well, girls lift their shirts. Girls have to lift their shirts. Whenever I put beads on them, they have to lift their shirts. That is not that I'm like, as a kid, it's like, oh yeah, this is what I've seen before, but we now know that it's coming from somewhere that they've seen it before. There's an abusive atmosphere. There's some objectifying happening somewhere in this kid's life. Red flag behaviors are going to be sexually explicit conversations, or with kids of the same age or with a significant age difference. So if these are sexually explicit, we're going into a lot of detail. We're going to be concerned about that. If we're talking about sexually explicit information with children who are much younger, then we're going to be concerned. And again, if it's much older, then we're going to be concerned. So usually you have the two options here of like an older kid being explicit with a child who's young and it's not appropriate for that child's young age, or a middle-aged kid who's going and talking to much older children who are probably on the precipice of adulthood, and the potentially problematic behaviors that can. Touching genitals of others, if we're seeing people touch each other, that's a red flag behavior. It's a safety issue. If it's repeatedly happening, then we're very concerned. Degrading others or themselves with sexual themes. So I've seen kids, unfortunately, as young as 6 saying they're not hot, not sexy. That's a pretty big red flag behavior, because that implies that there's this idea of sexuality and they're degrading their own sexuality. And we want to get involved at that point. Forcing, coercing others to show genitals, use of fears, threat, or force. This can often look like that bullying scene of like everybody else did it, or you said you would. And we really want to get involved there, because it's both harmful to the person who is using these phrases, because it can develop into some problematic sexual behaviors and problematic behaviors in general. And at the same time, we want to address it for the kid that is hearing this as well, because that can also create an atmosphere of problematic sexual behaviors where they feel like they are forced to do something, or where compliance is expected in all situations. Deep red, bright red are must stop, clearly abusive behaviors. So penetration of animals, children with a body part or an object, oral contact with the genitals, forced touching of genitals, or simulating intercourse with peers unclothed. That last one, I always like to add a caveat. You might be seeing imitation play. It is still a very red situation, and we want to be very present and aware of that. But if you have a child that's watched a movie or a video or seen something, they might be imitating what they've seen in the video. And so while the exploration is super important, you might find out that that particular one kind of drops down to like a regular red or a yellow situation after further exploration. So the goals of adult intervention throughout all of these are going to provide clear, direct communication. We're going to use non-shaming tones. We're going to use non-shaming words. We're not looking to shame anyone. We are going to ask questions about why some of these actions might be happening. Some kids at a certain age will be able to provide you with those. Little kids probably aren't going to be able to. And then we're going to use age-appropriate explanations to give them the information that they need. So we're not just going to ask these questions and then disappear. It is important that we give them the rules of like, this is what you can do, this is what you can't do. And we can say, this is harmful or this is harmful. This can cause boo-boos, this can not cause boo-boos, this keeps you safe. And again, you're going to adjust it based on age, but you want to make sure that you are giving them specific outlines and guidelines. Supervision at a higher level for some of these red and bright red activities. Parents can be, there's like a continuum of supervision that parents fall under, and you'll find that sometimes parents are on one end where if they need to supervise a kid, they start supervising every aspect of that kid, and it's like clamp down anything that kid had a sexual behavior, but now they didn't do their homework and it's got the same level of response and the supervision is super tight. And then you have the other side where parents don't want to know, and so then they don't provide supervision. And so you want to make sure that you're coaching parents and other caregivers that they need to be providing adequate supervision to children that have experienced sexual behaviors, especially around peers or with adults. And then referring for therapeutic intervention. There are some amazing people out there. I know one in the city of Cedar Rapids that can really provide a lot of empathy support and training on dealing with kids who might have sexual behaviors. And then there are some great interventions on how to approach kids who have sexual behaviors. So when we're evaluating a sexual behavior of a child, we always want to ask 2 questions. One is it a problem? And the other is, if so, what kind of a problem? So when we're looking at a problem, we're going to, we're going to take a minute to look at this problem, which is 2 7-year-olds having intercourse. And I am going to tell you right off the bat that this is over the clothes. They're imitating intercourse because it makes this project a lot easier. And we're going to ask ourselves what the problem is, or if there's a problem and what the problem is. And then we'll talk very briefly about how to address it. So we have, during a sleepover, the 7-year-olds stumble upon a sex scene in a movie and act out what they discover. What are they doing and how do they do that? So this type of problem is, yes, sorry, let me rephrase that. This question of, is this a problem, is yes, it is a problem because they are exploring and they're viewing something that's outside of their age range and they are getting this information. What type of a problem is the possible safety concerns for the children and possible safety concerns that they may share this information with peers, and that those peers may not have the same supports. So you're going to want to become involved. You're going to use gentle coaching. You're going to want to, again, set clear boundaries on what is allowed and what is not allowed, and then monitor what kind of videos these children have, or encourage monitoring what kind of access to videos these children have. Two highly sexualized 7-year-olds who have both been sexually abused are engaging in a mutually consensual, satisfying behavior associated with their sense of intimacy. Is this a problem, and where does it fall? This is a problem, and for me, this one always has fallen under the yellow, kind of between yellow and red. These are two highly sexualized 7-year-olds who are not being given adequate supervision, clearly, if they're able to engage in this act, but they are sharing feelings that they have felt in previous situations. So if these are undisclosed situations, then I want to know more about what happened. Where did we learn this? Did we learn this from one child to the other, or did they both have independent experience and then have found each other in this way? Again, monitoring is going to be important. If you have highly sexualized children, you're going to want to increase your monitoring of them, because there is more propensity for them to have victimization or perpetrate sexual behaviors. They are still learning and processing. And as adults, the goal is to provide that additional monitoring and support so that they're not learning and processing with other children who might not be able to either handle the information or be helpful towards them. The last one is two 7-year-olds, one of which has threatened the other with a knife, engage in this behavior. Coercion, bright red. We want to know what is happening in this situation. Where's one 7-year-old learning to threaten? And we're going to be looking at all of the aspects that this child is having, and we want to intervene immediately and right away and address both children separately. Hopefully that makes sense. When it comes to assessing a problem, we're going to look at the problem for the child with the behavior. So we'll want to know if it puts the child at risk. So if you have a child that's masturbating excessively, that's going to put them at risk for health issues. It might put them at risk for failure to complete important life tasks like school or being able to interact with others. The second part of that is problem for others. So problem for others is it might make people uncomfortable. It might violate norms or go against values, or it might break rules or policies. So those are going to be the kids where the problem for others is like, oh, I've exposed myself to my class or classmates. Again, that's an expected behavior, not problematic for the child, although it can put them at risk. It's more of a problem for others, and we want to make sure that when we're addressing that, we can talk to them and be like, this makes others uncomfortable. And then problem for both is always going to be if it's abusive or illegal. If there's an abusive behavior, it is a problem for both that child and for others. Same thing, if it is an illegal behavior, it is going to be a problem for both. I'm going to let Colleen take over interventions. I left you 30 minutes, Colleen. Sorry.
Your slides still mixed in as well. So I tried to kind of think through where some of these interventions in your work with children. And so like Tami was talking about when we were thinking about assessing the problem, right? And like what's going on with that, one of the first things I need to do with children when they come into my office, right, is assess their feeling identification skills and kind of where are they at, right? So some of my assessment interventions include something like inside outside feelings, and this can be done a number of different ways. This example, they recreated a mask on paper. I've done it with full body outlines before. My warning with using full body outlines, especially with young kids, is I tend to just get a smiley face drawn in and like clothes and stuff on the full body outlines. So sometimes with younger children, I'll adapt it and like remove the shape or remove the person and go to a shape like a star or a heart or something where there's not as much temptation to make that person look like a person. But what I'm curious about here, right, is what they're feeling on the outside, right? How would their friends describe them, their family describe them, versus what they feel on the inside, right? If I could see inside of all of that. I like this one a lot with kind of your older children and adolescents. Kind of that mask that we all wear is what I'm assessing here. And this is a nice one to repeat later on in treatment. And so being able to look back at how things have changed and what potentially, hopefully, progress has been made with that. Another feeling assessment, again, is pretty straightforward, but just talking about all the different feelings they may have. There's a great book by Dr. Seuss called My Many Colored Days. I'll put it in the chat. Honestly, I often will YouTube. There's a great reading of it on YouTube, so you don't even need to buy the book, although go support your bookstore. But I will often listen to this book with kids. And I like it because it talks about identifying feelings with colors. And so it transitions really well then to when we come into this expressive arts intervention, and we talk about the different feelings that they have. So I let them pick 5 or 6 feelings, we assign a color to them, and then they can show me how much or how big those feelings are in their heart by coloring that in. I added the picture of watercolors here because, again, working with adolescents who will be like, sure, I feel these things, but nobody knows, right? They're all on my inside. I hide them really, really well. One fun, that's an activity. You need to use crayons, right? So my warning is you have to use crayons, you need the wax, but I'll do this same activity. And even with adolescents, I'll say, hey, just humor me for a minute. Let's listen to this book. It's 2 minutes, right? And I'll get them to often humor me and listen to the book as well. But then I let them color in their feelings and I'll say, okay, all right, like you're really good at hiding those, right? I hear you tell me you can hide those feelings really, really well. And I'll give them a tray of watercolors, right? So I've had them use crayons. I try to get them to push hard, right? Like, get all those feelings out, like color them hard. And then I'll say, cool, show me how you hide them, right? Use any paint color you want, use as much as you want. I don't care. Like, show me how well you hide these feelings. And they'll inevitably go for the black paint. It does not matter how much paint they put on this paper. It will not cover that up. The wax will seep through. I will be able to see all of their feelings. I preface this with one time in 7 years, I had a client pressed light enough with her crayons and used enough paint that initially she was like, see, I colored them up. We let it sit on my desk for the week, out of sight of other clients. And when she came back, it had processed and soaked through. So I said, yeah, you got me right. Like that day you were able to hide them, but long-term, they're going to come out. People are going to see them. You're going to feel them. You can't hide them forever. And so let's process these feelings. Let's talk through where they're at. So with little kids, we just put with older kids who want a bit more of a challenge. I try to challenge them to show me how well they hide those, and then talk about why we need to address them because we can't just hide them forever.
On this intervention, I've also found it helpful that you're reflecting as they're doing the covering up about how much hard work it is, how much effort and time they are putting into covering up all of these emotions. And that can be really exhausting, and that can make us really tired, and that can make us have headaches, and that can make us feel not like we want to do anything else because you're just putting in so much work. Because I mean, like, they're usually like painting.
Yeah. So, they come in, we do this assessment, right? Okay. I know kind of where they're at, where they're feeling. The next question I get, a lot from parents is like, well, was it sexual abuse? Right. So Tami will talk us through a couple slides, kind of defining sexual abuse.
So defining sexual abuse, we are going to be looking at 3 major factors here around the sexual behavior. We want to look at consent, both implicit and explicit. That means that we are not just saying no means no, we are saying yes means enthusiastically yes. I love that change that they have made. You know, we want to make sure that consent is not compliance, and that we're not going along with it because either that's the expectation or we have we don't have any feelings about it. Yes should be enthusiastic. Consent, it should be yes. It should be definitely yes. If you have ever been online, there's a fantastic video online called Consent for Tea. And it's a great video. And I have the script for it if you'd like it. But it talks about giving somebody tea. And it's they say right at the beginning it's a metaphor for sex, but like you wouldn't pour tea into somebody's mouth if they were asleep. And at the same time, if you offered somebody tea and they said, you're not going to force them to take the tea, you know, you want them to say, yes, I would love to have some tea. And in the same way, we want any sexual encounter or sexual behavior to be, yes, I would like to engage in this sexual behavior. Young children do not have the ability to consent, but we are going to be looking at peer-to-peer interactions. We also want to be making sure that while children don't have the ability to consent, that there is equality between the two, because that's going to fall under coercion. So if we have a child who are the same age, two peers, and one is forcing the other one or leading the other one or using fear and manipulation, sometimes it's using like, you can use this, you can play with my game, you can join my group if you do this, then we're going to also realize that that is a sexually abusive behavior. Whereas we are going to look at it completely differently if we are seeing two children who are showing each other's genitals and that they came to it honestly and they were like, well, we just wanted to see if ours looked the same. That may not be a sexually abusive behavior. Yes, they cannot give consent, but they are at the same level experiencing it out of a mutual benefit versus one using power over the other. Coercion can come in a lot of different ways. You want to make sure you're looking at the roles of the people involved. Older children who are in a babysitting role, they have changed their role over that child, and that coercion, it becomes much more easy for them to do because they've been given this power. So even if kids are relatively the same age, if one is put in charge of watching the other, we're going to make sure that we have, this kind of leads into that equality. So if we have a lack of equality between the two kids, one really sensitive, tough one for, I think, outsiders to view as counselors, as parents, is equality between social groups. There can be abuse that happens through social groups, one social group being above, one wanting to get to that social group. So it might take some exploration into how a child's social group is developed and what are the rules within that group. And then my favorite question to ask is, what happened if you're not part of that group? And I mean, while as adults, sometimes we can process like, oh, if you're not part of the cool kids, like, okay, so fine, then you're not part of the cool kids. For them, it can be quite devastating. And so when we see that lack of equality and then we add sexual behaviors in, if they feel devastation not being able to be part of that cool group, they might be able to be manipulated using sexual behaviors, or they might be at risk for problematic sexual behaviors. Consent is they have to have knowledge that the behavior will be sexual. Again, with young children, they have to have knowledge that they're going to be sharing their individual. This is not like pantsing kids. We're not, you know, being pulled down. That is not consent. This is something that they both have come to have agreed upon and are interested in mutually. They need to know the standards for family or community. They need to be aware of the potential consequences. This is tough with younger kids. When we talk about consent like this, we're really talking about older kids, but we want to make sure that the older kids understand the potential for the consequences that can happen and then what the standards are. So if you're in a pool locker room, your standards are going to be different for what you're wearing, how you're interacting, than it would be if you were in your classroom. But you still have standards there, and there's probably a standard of like, we need to keep eyes on ourselves, or we don't make comments about others. There needs to be an overall understanding of those standards. And then free choice. They need to know it's okay to say no. Cooperation is not consent. So just doing it to go along is not consent. And then compliance is not consent. So allowing without resistance in spite of personal beliefs or desires. Equality falls under a couple of different sections. Let's move into equality here. We want to make sure that our kids that are having expected sexual behaviors are going to be on equal terms. They are going to have similar age, they will have similar intellectual abilities, similar strength. If we're looking at kids that are much bigger or much older, we're going to be definitely concerned about sexual behaviors between them. And if you have peers that are the same age, but one has an intellectual disability, we're going to be concerned, even though they are chronologically the same age, they're at different levels. We want to be aware of power, authority, and popularity, like I said before, and then the relationships and the roles between them.
There we go. So one way that I like to explore some of those variables that Tami was talking about, especially maybe the equality piece and just relationships in general, is using an activity, my family as animals. Right. So it's, we've probably all heard of like kinetic family drawings, like, oh, draw your family doing something. Those are great. They're wonderful. They serve an immense purpose in the playroom. However, using other manipulatives, whether it's drawing or I will often use miniatures or sand tray items, and having the child depict their family as something non-human. So one of my defaults is animals. I've had children use plants and buildings, and to me, it's far less important what they're using as long as it's not human. And I do that because I want them to, again, kind of remove the tendency to give human characteristics, right? Like, oh, she has brown hair and he has blonde hair. Not probably relevant to my assessment of what I'm looking for in this information. And so what I want is them to depict their family for me as, say, animals. And then I'm really curious, right, about why this person is a snake and this person is an elephant and this person is a turtle. And I can then talk with that child metaphorically about the characteristics of that animal. And it's safe for them, or often feels safer for them, to be able to talk about, well, like, snakes are really sneaky, right? And snakes come up and they bite you and you don't like that, right? And it opens that door, because now we're talking about the snake, and I might not like the snake, but it's a lot harder to say I don't like my brother, right, who sexually abused me. And so exploring family relationships, using animals or other non-human objects to assess those relationships.
I was going to say, this is a really great opportunity to use Alderian play techniques, because you can make it so personal. I've literally done this exact with a 13-year-old boy, but instead of animals, we did Norse gods. And then, like, you know, he was explaining the relationship between the gods, and he was putting his family into these different categories, and I could see the hierarchy, but it was something that related really well to him. Mm-hmm. Another thing that I just want to let you guys know about that is not mine, it's one of my wonderful office mates, but I think she's fantastic for it. If you've ever looked up the blobs, I'm trying to describe this, I don't have this on there. They are just like little blobby shaped people, and they're doing all different things in the scenario. And so having kids, mainly older kids, identify the different people in their family and what they're doing, and kind of telling you why they picked that blob for that person can be great. And it's kind of a more fun activity for younger kids, or for older kids, than it is for younger kids, because sometimes with older kids, like, having them draw animals is tough.
All right. If you guys are going to do any work with kids and families who have experienced sexual abuse, I highly recommend this book, Paper Dolls and Paper Airplanes. This is where this intervention came from. This book's old, right? Like 1998, old. But it's broken down by chapters and different age groups, and tons of great stuff. But one of my favorites from here is the Paper Dolls activity. And essentially you allow children to cut out or create as many paper dolls as they want, so they can identify immediate family members or other people, you know, people who were a part of their abuse experience. So the perpetrator, maybe somebody they disclosed to, you, whoever that may be. And then you can utilize various stickers. These are the ones that the book recommends. Sometimes I will add different colored dots or other stickers if there's other criteria I want to assess. So if I know other things have happened or there's been other big feelings, maybe somebody's been really aggressive and getting in trouble, right? I may add a different colored dot for people who are so angry that they're acting out or whatever I want to assess. But the child is then allowed to place various stickers on these people by their perception of that experience. So it's giving me great data on who's feeling hurt because the sexual abuse took place, who's to blame, right? And you'll notice in this example, this is totally, I just made this up yesterday. This is not a real kid's example. But this one on the far right may be the child, right? And they may feel responsible. So they may place some blame stickers on themselves. This kid, it looks like probably has done some therapy because the perpetrator only has blame dots, but that's not typically the case. They may blame themselves. They may blame mom, right? Mom took me to the babysitter's house. It's mom's fault that she didn't know the babysitter was going to hurt me. These are people who are brave, right? So we like to reinforce that. And we may put a smiley face sticker on people who know that I'm not to blame, right? So again, in this example, the child may not feel like they're not to blame yet, but maybe they recognize that mom or dad or grandma or grandpa or whoever this is tells them they're not to blame. And so just being really mindful of giving them a safe space. And I've had kids that there was no outline left. They've used so many stickers. But I do like this as another kind of assessment activity for where their perceptions are out of the abuse.
Yeah, this one got moved out of order, but just to reflect back, that is the third part of our triangle is what this slide is. And that's that coercion piece. Again, we talked about it earlier. Coercion is going to be a sign of sexual abuse or abusive sexual behaviors. We want to make sure we're having consent that isn't being got through trickery, restraint, violence, threats, privilege of one party over the other, force.
Yeah, go ahead. As I say, I'm going to start talking really, really quickly, you guys. Again, we could keep you all morning. But disclosures of sexual abuse, I mentioned it a little bit earlier, can be purposeful or accidental, right? And it's important for you as a provider to know what type of disclosure you're dealing with. So did the child actively seek to let somebody know about what happened? I actively sought out to tell my teacher or my parent or whoever. That's a purposeful disclosure. An accidental disclosure is one, either somebody walked in on the abuse, right? I didn't tell anybody, I didn't mean to. Or with kids, like I told my best friend and I said, don't tell anybody. And my best friend went and told an adult, right? So I disclosed to my friend, but I didn't purposefully disclose to cause a reaction and let the adults in my life know. So about 26% of children disclose on purpose. So if we think about that, 3/4 of them are now coming to you as a therapist dealing with this issue, which is, obviously an incredibly important issue to deal with, but they didn't mean to get here, right? And even those that disclose on purpose, when we think about young children, are like, hey, I told dad because I wanted the abuse to stop, but now I can't see my cousins anymore and mom's fighting with my school and like, I didn't mean for that to happen, right? So we have some of those feelings even with a purposeful disclosure as well. Only about 9% of preschool children disclose on purpose, right? So part of that comes from, again, not having the education or the experience to know what's happened or what to tell, not knowing who to tell. So just being really mindful of that. And, cultural considerations are really important when we think about disclosures as well. And so just being really aware that a lot of the information we have come from really individualistic cultures. So here in America, right, like we know that what interventions tend to be most effective. We know kind of what disclosure looks like. However, we know that the worldwide prevalence of sexual abuse is about 12%. So it's not just happening here in America. In Africa, rates of sexual abuse are thought to be as high as about 34% of all children. So, and 10% in Asia. So just being really mindful that we're learning more and more from other countries and other cultures about disclosures and treatment. And so being mindful of those cultural differences in more collectivistic cultures. And so I've worked with a couple Muslim families, right? And like that tendency to prioritize family cohesiveness, even in cases of sexual abuse, can really make a difference in disclosures and treatment if a disclosure does happen. So again, just being culturally aware of what that may look like in your playroom. Feeling, telling, learning is another one that comes from paper dolls and paper airplanes. There are a bunch of questions that go along with this. I think I've got an email link, so I'll send them out, but you guys can make up your own as well. There's nothing incredibly like special about them. It's just a great support to the game, but talking about different feelings that can be associated with sexual abuse. So an example is, name 3 feelings kids have about being sexually abused. So they can spin the wheel or roll the dice. And if they land on a feeling one, they can answer a feeling card. A telling example, right, is just essentially asking them to share information with you. So have you had bad dreams since you were sexually abused? Do you ever think the abuse is your fault? And learning cards prompt more of a psychoeducation approach, right? So what does sexual abuse mean? True or false? An adult has the right to touch a child's private parts. So you can utilize the ones that are given, or you can make some up based on the information you want to exchange with that client. Oh, we got 7 minutes. Holy cow. Okay. Stages of therapy. You have to establish trust, right? So we're not going anywhere in the playroom if that child can't trust you and trust the process in the playroom. So the child's allowed to come in and play or not play however they wish, right? They come in and they sit, that's okay. Most children want to talk about it. So I think those indirect messages from parents, sometimes it's like, they're just sad. No, like most children are like, cool, I have a safe place to talk about this. Let me share what happened. Once we start to establish that trust, we're moving into symptom reduction. And so exploring what are the symptoms that are happening. Are they having bad dreams? Are they having behavioral outbursts? And we may take a more directive approach in the playroom to help redirect some of those behaviors, identify the feelings that go with those, and talk about what behaviors we might want to replace. The same, right? So we may see some replaying the trauma. We might encourage some communication during play. We're going to let them replay and reprocess before we move into closure and termination. So in the playroom, we may see a variety of behaviors. Enuresis is one we talked about earlier as well. Often we see that outside of the playroom. Not a whole lot in the playroom. It can happen. But we may have parents that are like, oh, like they're wetting their pants or their bed all of the time. In the playroom, you might see that more as like they're playing at a distance. I had a client once constantly run out into the hallway and come back. Enuresis is often used as a way to keep the perpetrator away, right? If I'm smelly, if I'm gross, maybe this person won't hurt my body or hurt me anymore. So we don't necessarily see that behavior in the playroom, but we may still see that kind of like, oh, stay away from me behavior. Dissociation can happen a lot. Boys tend to dissociate more when they're doing something tactile or visual. So when they're playing with water or sand, girls have a tendency to just disassociate more easily without any added stimulus. So they could just be in your playroom and dissociate. We see a lot of potentially nurturing behavior as well. So they may express their need for nurturing. And so they may ask you to nurture them. They may nurture dolls or other items in the playroom. We used to think, not me, but we as a collective group of play therapists used to think that sand was necessary. But Gary Landreth let us know that it's not. It can be helpful in the playroom, but it's not necessary. So if you're like, oh, I don't have a sand tray, it's okay. You can still work with children who have experienced sexual abuse. Other behaviors you may see, abusive or negative nurturing play, drawings that are disfigured or missing body parts, some aggression, some self-stimulation can happen in the playroom. Kind of two-sided play, so like a two-headed dragon or things with, a good side, bad side type thing. Cleaning and cleansing can happen a lot. I had a child for a good 3 or 4 months that would come in and just clean the playroom. That was her ritual. burying and hiding, whether that's objects or themselves, right? So picture a client, trying to play hide and seek in a 10 by 10 office. They find a way to do it, but they want you to find them. Are you safe? Do you care enough about them to find them again? We may have clients who struggle with sexual verbalizations or removing clothes, right? And then some of that push-pull attachment. I love you, I hate you, and that back and forth that can come with figuring out if this is a trusting relationship. Courage in the playroom, we've talked a little bit about blame. They may feel responsible. The world's not safe to them, right? So there may be some fear there, some betrayal, like the grownups who were supposed to protect me didn't. Powerlessness. I've had kiddos who have purposefully disclosed multiple times and nobody has listened. And so worry that nobody believes me and nobody cares. Loss, right? The loss of that innocence. Like, here's my expected growth chart and now I'm dealing with issues that I shouldn't yet. And some destruction, right? So especially as those kiddos get older, we may see some of those behaviors that Tami touched on earlier with the impulsivity, some disrupted eating. When things feel out of control for kids, they can control two things. They can control what goes in and what comes out. So we often see the enuresis and incompresis because I can control what comes out. And we see some disordered eating because I can control what goes in. And oftentimes with kids, that's the extent. Somebody's telling them where to go, what to dress, where to be. So they don't have a whole lot they can control. So we see a lot of those eating and elimination disorders. Sexualized behavior in the playroom, right? We may want to reenact that sexual abuse. We may have sexualized symbolic play. We're just trying to gain understanding of what happened. They may try to reenact that trauma in your playroom. So with different manipulatives. One way we can address that is trauma-focused CBT. If anybody's not familiar, down at the bottom of that slide are some great ways to work through the certification. 100 years ago, it was free. So I got to do the 10, I think it's a 10-hour course. I believe they're now charging, last I heard it was $30, but I looked at a website yesterday and it was significantly more, which they deserve to charge a lot more. But I really like TFCBT, especially when working with kiddos with sexual abuse. It has been normed among a variety of cultures, which is also great. So if you haven't checked that out, check that out. Again, I could do a whole training on that. And we have like 90 seconds left. So Tami, I'm going to skim through these really, really quick. These are kind of going back to those green, yellow, and red light behaviors that Tami talked about earlier. So just giving parents information about how to respond to those and be direct in that communication. Kind of mirroring those red, yellow, and green lights. Tami, if you want to go up real quick, one slide, you can go backwards. There's another red light, yellow light, green light intervention. And so even I can do this when kids need to get some energy out, but talking about, is that a green light, yellow light, or red light behavior? So green light, high five to my friend if they, if we scored a goal together, and helping them start to identify what behaviors fall into what categories. Me and my caregiver is another kind of expressive arts intervention. It can be done as a family session or an individual session, but they can create collage, they can draw, they can act out. In the book, it talks about me and my mom. I think that's a little old, right? We're past that. What their caregiver was like before the abuse, when they found out, they want what the child wants that relationship to be. Pieces of me, somebody asked this question earlier, right? Like, how do we help them figure out who to tell and who not to tell? This is one way to do that. So helping them identify the people in their life that they feel safe with, who support them, adding that puzzle. And then under each person's name, adding the characteristics or qualities of like why these people are trustworthy, and helping the child process why those pieces are important, what characteristics they possess, and how they could assess kind of if other people have those qualities. Okay, we're almost to the end. So self-care for parents, even if you are a therapist, you're working with the child, you're working with the parents as well. And this is hard stuff. And so just helping the parents find ways to take care of themselves as well, because we want them to be in the best space they can be. So that may mean that they're seeing a provider or they're working on some healthy habits, so that they can be present for their child as they go through this work with you. And then also on the next slide, just taking care of yourself as well, right? This is hard work. You guys need to take care of yourself as well. Self-care is such a buzzword right now. I don't like the buzzword it has become, but the practice is necessary. And so making sure that you guys are taking care of yourselves and engaging in case consultation, your own therapy if needed, trying to limit the number of sexual abuse cases on your caseload at any given time, because it is really deep and intense work. So just being really mindful of your needs as well. Okay. There is a quiz, not my choice, not my fault. APT says that to receive credit now, they have updated some of the COVID regulations, and we are back to, we do need to complete a quiz to get credit, even non-contact credit. So the quiz is there. It will automatically send me your guys' responses and email addresses. So once those populate on my response list, you will get your CEU certificate emailed to you from me. And I will throw, I'll throw the evaluation in there as well. There's an evaluation if you guys would be so willing as well. So I want to be mindful. We're 2 minutes over, you guys. And I think next time we'll do this as a longer training. So if you have to go, please go. You won't hurt our feelings. But otherwise, Tammy and I be happy to stick around. Yeah, thank you guys for being here. This is the first time Tammy and I have done this one together. So again, I really, really appreciate you guys being willing to join us this morning. If you have to go, but you have questions, feel free to email us as well. We'd be happy to answer anything that we can.
Hey, I really appreciated all this information, especially practical activities. Are very helpful. I appreciate that. Sorry, my internet is funny today, so and I've tried to put the video on, it messes with my sound, so I apologize for that.
That's all right. We're glad you were here.
I am too, but I'm wondering a little bit about your treatment plan, how you organize your treatment plan. I do school-based therapy with kids, and I think I'm going to change it up a little bit this year because it doesn't cost parents anything. There's no insurance. They don't have to do any of that. It's on these mental health grants, which is wonderful. I also have a degree of separation from the school, so I can protect clinical information. I don't have to share that. So this year, I want to change things up a little bit and have parents committing to maybe once a month or once every 5 weeks, they need to have a Zoom meeting or they need to come in and meet with me. We're just, like I said, building this program, so we're sort of learning as we go. And I'm thinking about how you structure treatment planning around the sexual abuse for your elementary kids to help parents be the support systems they need to be at home.
Yeah. So I guess I want to make sure I'm understanding, like, what does a treatment plan look like, or how do I get parents to be involved in that treatment plan and do the follow-up kind of involvement?
Well, I'm more interested in what the treatment plan looks like that is user and parent friendly with parents. I've seen a variety of them, and I'm not in a role that I have to do treatment planning at this point, but I'm at the point of saying, what am I doing if I'm not? So I need to develop that. And I'm wondering how you set that up with, because some kids come in, the issue is a sexual abuse issue. And sometimes it is really an exploration, or sometimes things come up in between. You're working with a kid on, depression or acting out or whatnot. And then we come to it.
Yeah. And I think those are really great questions, right? And it kind of depends too on, sometimes on what the, especially if it can depend too on like, what are the goals of DHS or CPS that are involved, right? Are they wanting reunification? Is this no longer going to have contact with the offender, right? So kind of getting all of that assessment information is one step in kind of identifying, okay, what are the goals going to be? And then just like I would with anybody else, kind of talking about where are we at right now, right? Are we having such big behavioral reactions that we need to do something to address and reduce those behaviors so that we can get into the abuse, right? Or do we have a client who maybe is a little bit more removed from the abuse and is feeling safer and has now disclosed and wants to address it? Do they want to pursue anything legal, right? Do I need to get them ready for court, or is this a situation that's not going to court? And so a lot of my treatment plan depends for me on what's been shared and what are the immediate kind of next steps for that family, and kind of making sure we're addressing them, not necessarily in the order I would want to, or even that I think sometimes the client needs to, but that we have to because of next steps. Tami, I don't know if you have any other like pieces of that part of things.
Outside of court issues, I think what I deal with most when I'm writing treatment plans for kids that are in a situation where they are trying to get more trusted adults involved outside of just a counselor. So these are usually the parents that come in and say, I just want them to talk to me and they won't talk to me. Is I write goals that are like, client can identify 3 trusted adults that outside of therapy or outside professional relationships. And then once we get those 3, then maybe client feels comfortable talking to adults 20% of the time about feelings. And then the other part of that is going to be some of the teaching of parents, like, I can't choose who the trusted adults are. That's not something to choose. All I want to make sure is that outside of this relationship, for therapy to be considered successful, that there are people out there that are safe for them to talk to, that they feel comfortable talking to, and that they can share feelings, especially intense feelings, with. I can't make them choose you. I can't make it be you. That's really hard for moms to hear, and I have every bit of sympathy for them. But our goals are going to be about developing those trusted adults and letting the child pick their trusted adults rather than forcing them into, this is who you're going to talk to.
And when you're doing something really directive like trauma focused CBT, one of the components is that it has to be shared with a trusted adult. And there's a lot of reason behind that. Like we typically don't want that to be just the provider, because I'm not going to be with them in their everyday life after therapy. And so part of that is helping them recognize that support system or identify that support system so that they can start to expand their sense of safety and comfortability with that person. So, again, like Tami said, those goals may support work on sexual abuse, but may also look like a bigger picture goal as well. And for me, sometimes goals are, depending on where that client's at, goals may be as direct as like, client will engage in work consistent with, protocols of TFCBT, like to process sexual abuse. Like if that's what the goal is, if that's why they're there, and I know that's what they want to do, like we may have a goal that reads kind of that direct.
Okay.
I did link there in the, it's not mine, but there is that link in the chat box, talks about just some kind of general goals or interventions you may see in working with children who have been sexually abused. And again, some of these include like connecting with the offender, which sometimes is not a goal I wish we needed to explore, but sometimes is out of my hands. So learning how to kind of help with those goals, if that's a direction we have to, or, going to court, like the child may say, I don't want to, but, part of my work with them may be getting them ready for that. So yeah, there's great questions though, because those treatment plans they can look so different. And I love that you're able to, or will be able to meet with those caregivers, because it's one of my biggest frustrations is some of the insurance companies tell us that we can't. And so some of the private insurance companies say, no, you don't need a session without the child ever. Yeah, I do. Right. Like that. Yeah, I do. So you're going to have that option for the clients you're working with as well.
Well, and I'm really fortunate too. I'm finding, especially with that age group, that being able to have direct communication with these kids' teachers, just because, and I don't have to share anything, and I don't, but the teacher knows they're coming to me because they're coming out of their classroom, but they'll come to me and they'll talk to me about what's going on at recess, what's going on in the classroom, how things are socially, that really no parent or no caregiver can give you, but it's such a huge part of that elementary kid's life that even after I move beyond school-based therapy, I've come to the conclusion that that primary teacher needs to be a information source for me always, because it just gives you such a full rounded view. You know exactly what the parents are seeing and thinking and what's going on, the dynamics at home. You know exactly what the dynamics are in the classroom or the social stuff or that kind of stuff. It's unbelievably valuable. The other thing is the school is nice because they know about interaction kinds of things between the kids and the families that I wouldn't normally be finding out or asking about. So anyway, I appreciate this. Was very helpful to me. The only other question that I had was I've been faced with a few kids, you know, like you had touched on it, seeing some alarming things online. And a lot of this, what I'm hearing and seeing now is there's a lot of this going on during these gaming kind of things that they do. And I've had second, third graders seeing things that are really alarming that to them seem like an attack or an assault that sticks with them. And they may not have told their parents because they don't want the game console to be shut off. But I'm dealing with that kind of outbreak at those tender ages of what do you do with, you've seen this picture of this and it scared the crap out of you. It was, you know, intercourse with somebody bloody, you know, that kind of thing. And I feel like I'm fielding more of that and more of third grade, fourth graders and these nudes back and forth that aren't necessarily a sexual abuse kind of a thing, but that's like its whole other realm. And so I really appreciate your information about red, yellow, green and being able to kind of talk about what's, you know, what's safe and what's not. And thank you so much.
Yeah.
Do you have any thoughts about some of these shocking incidental traumas of seeing pictures or snips of videos and then just trying to process that when that's not necessarily the issue of the kid? It just happens too.
Absolutely. And I think that we see that with various types of trauma. Even in, when I do trauma assessments in general, one of the things talks about like, seeing war on TV or seeing things on TV. And it can be really hard to distinguish of like, is that real or not real? And so one, helping them explore, real versus not real. And then one thing struggling with intrusive images or thoughts or things like that, is even having them recreate the image, right? So, okay, like draw me the image that's stuck in your brain. What could we add? Or they could do a sand tray about it, right? Like create this image. And I may have them take away pieces that they wish weren't there. So they may scribble them out, remove them from the sand tray. And what are some things we can add in? So they may be adding some safety figures to the sand tray or adding a speech bubble that says no, or, putting clothes on them and have them start to recreate that image in a physical sense can start to give them that sense of mastery and control over that image so that when it then comes into their brain, they can then think about the alternative image they've been creating with you.
Okay, I really like that. Thank you so much.
So, Kathy, I do have an appointment I have to run to, and I'm sure Tami does as well. We're really glad that you were here. If any other questions come up, don't hesitate to reach out to us. And I've got some other trainings coming up as well. So if you want to be on our mailing list, I think there's that question on the eval that you can get added, or just shoot me an email. Keep you in the loop with other things we're offering as well.
Thank you for joining in on today's training. We look forward to having you join us again. Heart and Solutions is proud to provide CE eligible trainings for our counseling community. This training may be eligible for continuing education credit hours through either the National Board for Certified Counselors, provider number 7376, or the Association of Play Therapy, provider number 21-645. To obtain CE hours for today's training, be sure to follow the steps in the description below.